on this day, we remember and also create awareness for these purposes. No one can say that me, I'm not part of it. Like when we started this engagement meeting with the stakeholders of different sub-county, there are some rumors around that people who are coming here, are you having HIV? There are those rumors just around the communities. But as I say, all of us, in one way or the other, we are affected or infected by this disease. Then in Moyo district, we have cases of these HIV infections. And our prevalence rate of this disease as of now is 2.3%. That roughly means in every 100 people, there are at least 2. When you, at random, when you test 100 people, there are at least 2 who will be tested positive. So this infection is true, and the disease is real, and it is with us. So those various interventions of prevention, care and treatment, which we know, I encourage us, we should continue with each. HIV is not witchcraft. Then all the interventions which we talked of, and the strategies of mitigating, including care and treatment, through our government, all these interventions, strategies are free of charge. We test for free, then also the treatment we get from our health centers, hospitals.
Doing well in terms of us being tested for HIV. However, as a district, I think we need to encourage more of our colleagues, and also we need more support of the political leaders to encourage our people that HIV is still there and they need to actually know their status. And I think that will go a long way to fighting HIV. The second point is about our friends who are living with HIV. Currently, we are supporting about 1,500 people living with HIV in Moyo district, majority of whom are supported by Moyo Hospital. I think specifically for Dufile, we are supporting about close to 100 people in the sub-county living with HIV. And Dr. Isaac there has been very key in supporting the sub-county under Dufile Health Center 3 in the fight against HIV. So I want us to give a hand clap to Dr. Isaac for supporting the sub-county here. Still, when we are looking at HIV prevention, we have a number of factors and a number of preventive mechanisms. One, we talked about the pre-exposure prophylaxis, the PrEP, which is the medicine that you can take if you are at high risk of HIV but you are negative, and that helps to prevent you from acquiring HIV. The second one is the circumcision, the safe male circumcision. I think this has even been studied in our own country, and we need more support from the district leaders as the program to make sure that our men are circumcised. And when that happens, it has been proven scientifically that it reduces HIV by about 60%. So we need more support from the district leaders, from the sub-county leaders, and my team will be reaching out to the district leadership to support this program more.
Of human rights to health, not to be a privilege to all but a few. I think some of the people who are out there who are in the rural areas have not yet been reached through. Today the convention remains a neutral challenge to all of us, especially as the young people, I speak on behalf of the young people who are living with HIV and those without. That is to say, our categories are different, but still they say we are either infected or affected in all ways. Both the adolescent girls and young women, the adolescent boys and young men. We are all in this together. Much as the young girls and adolescent women are all leading in everything that we do. If you take right now, I've attended a meeting that was about SafePal that has indicated like out of 15,000 young people who have been infected, 12,000 are women and the young girls. What are we doing in the community? Are we okay? And it is you adults, you men, I'm sorry to say this, who are signing our eyes. You will be like you have the money, but still you're ruining a young girl's life in the society. What are we contributing to the lives of these young people?
The theme for the World AIDS Day for the world is take the right path. My health, my right. As for Uganda, we have the theme accelerating intervention to end AIDS by 2030. This is in line with our Sustainable Development Goal, which is ending in 2030. The national HIV prevalence rate stands at 5.1% compared to MOYO, which stands at 2.3%. When you compare the statistics, at least MOYO district is far better compared to the national prevalence rate, which is a very great achievement. And on that note, I want to thank my gallant health workers and the implementing partners, especially IDI, and other implementing partners for the effort you put in achieving this milestone. I want to thank you for so much
that we participate in HIV/AIDS activities. And it is true that the 0.1% that all governments must ensure that in their budget they find something to support HIV/AIDS activities. And that 0.1% is not only for celebrating HIV/AIDS Day. It is supposed to support activities towards reduction of HIV/AIDS. So let us be clear about that. But if there are challenges in accessing those funds, we can be able to follow it up. I pick it up, we shall find out. In the last 9 years in Moyo district, there is no child born with HIV/AIDS. Please clap your hands. For the last 9 years, all the children born in Moyo district, there is no single child who has been born with HIV/AIDS. That means that all of us are working. That is credit for Moyo district. So there is a hope. If you are positive, you can give birth to children who are not positive. For the last 9 months, there is no child who has died in Moyo district because of malaria. That is positive. That means that you community members are responding to the messages government is sending to you.
My ministry is very clear and loud, and I was very clear and loud on behalf of government of Uganda. We do not have any law, any policy, any document to enable you as a health worker to give family planning contraceptive methods to girls below 18 years in order to prevent teenage pregnancy. Yet you are promoting HIV. You are promoting sexual diseases. So we want to appeal to all health workers who are promoting, who thinks they are promoting contraceptive for the girls. The law will deal with you, because we do not have that mandate to enable you to give contraceptive to the girls. Family planning method is for the married people. It is them to think about it. It is the responsibility of the married people to decide on their faith, but not our school girls. Not the school girls, not the school students. I want to caution you, and I will never ever get tired of speaking the truth, nothing else but the truth. So I want to appeal to you as you advocate for sexual reproductive health and rights for the youth, for the teenager, for the girls. Please advocate for abstinence. Advocate for behavioral change. It is that can empower the girls. Because you are promoting HIV/AIDS. If you think by giving contraceptive the girls will stop messing about. You are stopping pregnancy, but you are promoting HIV and AIDS. So I want to thank you for your work. But I want to caution, that should be our stand. And Mama Janet, I speak without fear, without favor. Those are her message. I can always speak on her behalf.